All right. Hi, everyone, and welcome to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse educator, advocator, and navigator. And tonight I have my good friend Carol Hayes with Placing Russell. So, Carol, tell the audience a little bit about yourself, and then we'll get into our topic.
Sure. Well, thank you so much for having me. I'm Carol Hayes with Placing Russell. We have been in business since 2014. We're family owned and operated. And about me, I have a background in nursing facilities, working in pharmacies, working for physicians, coding and compliance with the physicians and pretty much any kind of healthcare facility or place that you can think of, I've actually worked in. So that's a little bit about
Wow,
me.
that's a pretty extensive healthcare background.
Yes,
Yeah,
I've been
yeah.
doing it for about 25 years.
Wow. So you
Yeah.
started placing Russell. Tell me a little bit about that. What was the reasoning for it, and what do you guys do?
Yes, thank you for asking that. That's actually the most important thing about our organization is why we started our organization. So placing Russell was my father. My business partner is my mother. Her name is Peggy, and that was her husband. And back in 2005, when I was in the healthcare field at that time, still, of course, and unfortunately, my father fell ill and he went into cardiac arrest and had some strokes. And
Mm,
I was familiar with the healthcare field, but when that happened to us, my experience with heart attacks and strokes at that time was you either survive it and get better, or unfortunately, you pass away from it. And when this, happened to my father and our family, we realized that there is surviving it, but there's also illnesses that come with that. And so, unfortunately, he was diagnosed with a traumatic brain injury, of course, in the
mhm.
beginning. We went through about 2 years worth of rehab to different, of course, LTACs and acute, rehab hospitals, and then traumatic brain injury hospitals, and mapping up the brain and trying to just figure out a way to get my dad back home. And like I said, I'm in the health field. So, when you're in a certain field, you think you kind of know a little bit about it. And then you realize there's this whole big other animal. I
Right,
know you know about
right.
that.
Yes.
And so going through that, unfortunately, we weren't able to bring him home
Mm,
because, like most people, our world was still spinning with work and my mom was still working. He was unfortunately only 57 at the time. My mom was 54, and so she was still working. And so we
wow.
had to find him a facility at that
Hmm.
time. And so that too brought up another portion of the healthcare that I wasn't familiar with in the type of care that he needed. You would think that, okay, you can find a place, healthcare individuals know where he needs to go, what's right for him and his individual needs. But that's when you find out people are really individuals. And there's a lot more to it than, insurance paying and figuring out care 24 hours a day. And um,
Hmm.
even people that are prepared with life insurance policies that have great policy amounts, things like that,
Right.
sometimes you don't realize you have to apply for benefits. And that's when I realized that there are a lot of agencies that can help you with placement options and help you guide you through that, but there's not a lot of agencies. And we were in a blessed situation, but there's not a lot of agencies that work on fixed income and help people that may need to apply for Medicaid, even families with income that think they don't qualify, but they do, but can't afford those $5,000 to $6,000 rates.
Hmm.
And that's actually what brought Placing Russell about is we help with placement, but we specialize in low and fixed income. And it's all because of my dad. We wanted the best care for him, and we went through a lot of roads and bumps. And, we were just so blessed to have people in our path just to get us that right direction. But we wanted to do that for people because we know there's not a lot of resources for it.
What an inspiring story. It always starts with an inspirational spark, right?
Yes,
I think a lot of
yes.
people who are in healthcare or who are or have been in healthcare, everybody has a story, right?
Yes, and you know what? And then you realize that every patient's
Hmm.
family or patient or anybody that you come in contact with, you feel connected because they are going through what you've gone through,
Right,
or they're going through something similar, and you can empathize with them.
right.
So that's so true. Everybody
Oh
has a
my
story.
goodness. Yes.
Um,
So your placing Russell company focuses on people who are maybe have a lower income, that people who are on Medicaid. Can you
well,
elaborate a little bit on that?
yes, and thank you for asking. So we work with private pay. We have lots of
Okay.
private pay options. So
Okay.
we work with private pay, but we also do specialize in low income.
Okay.
We help people with non-medical and medical living options.
Uh-huh.
So from independent living, the senior independent livings, not like independent apartments, but independent livings, group homes, residential care homes, assisted livings, things like that. We can also advise on skilled nursing options and
Okay.
long term care, because that is my background. I worked in nursing homes for about 10 years as well. And I can give them some advice on, the ins and out of it, what to expect, and
That's
answer those
awesome.
questions.
That's
Yes, and then
awesome.
what we do when we actually get a client that we work with is we screen them for all options, especially if they're on a limited or a fixed income. If they can get Medicaid benefits, whether it be assisted living benefits, attendant care in the home, get into a nursing home and need how to apply for that, VA benefits, we can help kind of screen them for all of that, get them the information that they need directly with those resources rather than referring them on to like another agency that would charge, so that we can screen them for all of those benefits without it
Oh,
costing them.
wow. That is
Yeah.
such a wonderful service because what happened with my mom when she went into the hospital and they give you those 3 days to find a place for mom,
Yes.
hence the
Yes.
other company,
Yeah.
but
Oh,
they
they're
give
good
you,
company too.
yes, but
Mhm.
they don't give you that resource in the
No, I
hospitals.
know. I wonder. Yeah,
You,
I
you know,
don't know why they don't get more placement agencies.
exactly. It seems like that would
Yeah.
just be such an added benefit because it was such a stressor. And I like what you said when you said, even though we're in healthcare, we still are like, ooh, I don't know where to start sometimes because it's very overwhelming. So they gave
Very.
us a stack of papers saying that, okay, these are some facilities that they got off Medicare.gov. And then we
Oh,
had 3 days, 72 hours to, see which place we wanted. At that time, I had no clue about companies that have your service,
kind of guide
none at
you
all.
through it.
So,
Wow.
you look at the top and then you're like, okay. And so we started going around to some of these places in between work and lunch or whatever we could spare up. We felt very rushed. We felt very stressed out. We felt like, how do we make the right choice? So, to find a company that does the services that you guys do, it alleviates a lot of stress.
Yes, that's the point of it, is to try to go through and kind of weed out the options that may or may not work for your particular situation rather
Right,
than giving you a listing. Making sure that the options that are given to you do fit the
right,
criteria and the
right,
needs. So
right,
I appreciate you saying that, because that's another thing about a lot of the placement agencies is we're a non-biased,
right.
you know what I mean? We're
Mm-hmm.
not the one agency saying, and not that's great that they're able to do that. All the everybody's going to say their own services are great. Of course, we're going to
Mm-hmm.
highlight our great services, but we are a non-biased look at options. We can say, look, here's these options that fit your criteria. Here's the options that fit within your budget. Or if you need a nursing home, and you're going for rehab, kind of like the social workers and
Right.
caseworkers are doing in the hospital. But we're saying, okay, this is our experience with these, and this
Right.
is what we know about these.
Right.
And
Right.
it's a little bit different look into it. So, and I
Yes.
think that's the great thing about a lot of agencies that do this.
Yeah, and I just think that you guys should be on that resource list because it's just an amazing service. Because whew, to get a list of names and numbers, that didn't help me.
No,
You
because you had to
know,
go through all that information.
exactly. And then you're on borrowed time, right? Because you
Yeah,
probably have to get back to work, or you may miss something, or you don't know what you don't know to ask
there you
about these
go.
facilities. So I like how you guys sit with the client. So explain to
Mhm.
me and the audience a little bit about how you guys determine what services are a good fit. There you go.
Well, exactly, and thank you for asking that as well, because what we do is we screen them pretty much. We do a pre-screen on everybody, and it depends on um, what the need of what the need of the client is as well. If they are someone that is needing placement, and let's say they're on a fixed income, we're automatically going to look and see, okay, they may have to do say a lower income group home for a while that only provides a minimal amount of services. But because they're on that limited income, they do qualify to go to an assisted living through Medicaid. And so we would screen them for that. And although in Tarrant County, there's a wait for that program of about 8 to 12 months right now,
Yeah, yeah.
unfortunately, we can help make sure that they get on that waiting list so that when they do go to that group home that only provides a certain amount of services, or it's not necessarily a facility that has all of the amenities that they would need, we know they can at least transition from that group home to that assisted living. So we make sure that they know about those services. If there's someone that can't sign up, and we have permission, of course, with HIPAA, we have to have a certain amount of information to be able to make those referrals. But whether we go through the social worker or the case manager or the counselor, depending on what type of hospital it is, or the family, if we're not doing it, ourselves, we make sure they have that information to get those services.
Mhm.
Of course, we screen them and ask them if they're veterans. A lot of veterans can get certain services, and
Right.
we don't turn around and refer to other, companies that charge a fee. What we do is actually, we've somewhat learned, I won't say we're experts at the VA, but we've learned their benefits, and we understand the war periods and what non-service connected benefits and service connected benefits are, and who can get what, and beyond just going to the VA hospital. So if they're a veteran, we make sure that they know what type of services they get. We hook them up directly with the clinic that they go to, and make sure they understand what benefits they need to apply for. We do, that pretty much on all clients. Now, if we know that they have a lot of assets and income, we can go say they need nursing home, and say right now they have too many assets to apply for Medicaid programs.
Mm.
We can go over with them their plan and figure out how long, if they need care, their money's going to last them based off of the monthly income and the savings, and about when they would start need to looking at applying for Medicaid. So
That's
even if it's
awesome.
not, yeah, even if it's not current services, we can look at future planning
Oh,
of those services and advise them that way as well.
oh, that makes so much sense. Oh my goodness, that's awesome. Because what
Right.
happens a lot of time in the world, boom, it's time to make a decision right now and do
Yes.
some planning when you
Yes.
could do pre-planning.
Yes.
I think that's wonderful.
And more often than not, what
Mhm.
happens is they run out of money in savings, and their, monthly income, uh, had to be supplemented out from their savings. And like you said, it's a last minute, oh my goodness, I thought we had time. Now mom's went in the hospital, and all these things happen, and then we still had to pay over here. And then all of a sudden it's kind of like, bang, we need a decision, and we've got limited options. We
Right.
can we can we can help with quite a few, situations. We try to make sure that we give them not only the options, but the education on what to do for
Absolutely.
themselves.
Absolutely. Because every place is different with different
Yes,
amenities, different, services, different qualifications. And it
yes.
can be very confusing because some people may think all the homes do XYZ, and that's not true.
That's a big deal too, and you know
Hmm.
this because I'll get questions for listings all the time, and we don't send out listings because what we do is when we give out options, especially if they're in the hospital and they've got a discharge at some point fairly, sooner than later, or
Hmm.
rehab, you only have a limited amount of time, like you said. So we give them that information so that they can go
Right.
ahead and pre-plan, have it ready, and then we only give them options that have availability at that time,
Right.
rather than giving them a listing where they're going to call all those places and sometimes they don't have an opening, or it's too expensive, or they don't provide the service like you were talking about.
Oh
So
boy.
we give them the information that's open at that
Hmm.
time.
Yes. And then another
Yeah.
thing too, as I was saying, is that some places take people with peg tubes, some people places don't. Some places take people with on the ventilator, some people don't. So you
Yes.
always want to ask certain questions about the quality of
Their
the
daily
care,
need.
the standard, yes, their daily need. There we go.
Yes,
Yes.
and two, sometimes there are some places that provide a little bit of more assistance, but they don't have someone overnight. And if someone's a
Oh.
fall risk or things like
Oh.
that, you got to be real careful, like you said, to make sure that they have an attendant there in the evening. And
Right.
when you're working with lower income, you got to make sure those options are available for them. So that's a
Oh.
big deal. Like you said, their daily needs, their attendant needs, um, their history and all of that goes into making sure that the options that we give are going to make sure that it fits their needs.
Right. Well, I love the personalization that you guys have because I'm blood on this show. So no hope for it. When they
That's
give
okay.
you a list at the hospital, and 9 times out of 10, you're more inclined to start at the top of the list. That doesn't mean the
Correct.
best.
That's right.
That doesn't mean the
That's
best. And you
right.
guys know personally, who really, just because they have 5 stars,
That is a big deal too.
it makes a difference to be able to know somebody who knows somebody in that facility to be able to say, okay, this client fits, this client doesn't because you guys can't do XYZ, or you guys, maybe it's just not a good fit, so that's so
Right.
important.
Yes, because sometimes, like you said, you may go with an option that kind of says, well, we think we can do that and we can handle the care. And sometimes that's not always the case. And you would assume, especially like you said, when you don't know earlier what you don't know,
Hmm.
and you're a family member that's going through the emotions
Right.
of choosing a place, your world's still spinning, you're still working, all of these things are, excuse me, all of these things are going on while you're making a decision. And the last thing you need is to have more work to go through and cipher through. That is why these agencies are doing this. I mean, they really
Right.
are. That's why we're doing it, is to be able to kind of, like your agency, you're helping people, you know what I mean? You're helping people
Hmm.
manage the things that we're not supposed to know if we're not in this
Right.
field. I mean,
Right.
I don't know plumbing, and I can do a few little things, but I couldn't do, plumbing
Hmm.
underground. We're not
Oh no.
necessarily supposed to know all these things.
Right.
So that is what these agencies are here for, and I know your agency is doing that for people too.
Oh, well, we love it. We love it. Well, another
I
good thing about your agency is that there's no charge to the clients.
No, not at all. We do not. And
Hmm.
we do about 90% of
Right.
lower income and free resources.
Okay.
We get a lot of calls, and we still do a large amount of placements as well, but there's such a need for the resource information and the transitional service information. So we do quite a bit, and there is no charge to our families or social workers or anything like that.
That's awesome. So you mentioned social workers. So
Mhm.
what are the credentials of some of your staff?
Well, we don't have staff. We're a family owned and operated business. So
Uh-huh.
I am the one doing all the referrals ourselves. We screen everybody. And like I said, my background's in nursing facilities, and I'm not a clinician or anything like that by trade, but I did evaluations for 10 years in nursing facilities
Mm-hmm.
for,
Mm-hmm.
pre-admissions and ordered equipment and all that kind of stuff. And so I kind of learned by trade, and so I know quite a bit about the nursing,
Yes.
homes and evaluations and mental health exams and things like that, that they do. So I learned kind of foot by fire. And then when we started our organization, it's just my mom and I. We are working on our nonprofit. I think I told you a little bit about
Yes.
that
We'll
prior. We're not
definitely
quite
have you
there.
back to talk about that.
Yes, that's what I was
Yeah.
going to say. We're not quite there yet, but we are working on it to where we can open up a center and have more staff to do a lot more one-on-one. Of course, pre-COVID, we would go out to the hospitals and people's homes and things like that and do one-on-ones. Right now, we're doing everything by phone. We are doing some one-on-ones, like we've got some clients that have some one-on-one needs where we're
Mhm.
helping and making sure we're still catering to those that even during, a pandemic just wouldn't be able to get benefits without it.
Right.
So and then what we do is I actually screen everybody and I actually do all of our referrals. I mean, I typically have a caseload of about 50 to 100 at any given time.
Wow.
But I'm able to handle it. I know our benefits and our resources pretty well. I've been in the Dallas Fort Worth area doing this for a long time, so I'm pretty versed. And then my mother, who's Peggy Harrington, Russell Harrington's wife,
Mhm.
now, unfortunately, but she actually screens all of our residential care homes, assisted living, and group homes. She goes out and tours them. She sits down with them. She meets with them. She gets their criteria. She
That's
spends a couple of
exactly what I
hours with them.
mean. That
Yes,
is exactly what I mean because I guarantee you that list that you get from the hospital that has all these
they've
wonderful
never seen them.
facilities, nope,
Yeah.
never seen them.
Yes.
So they're giving you a
Yes.
list and you have to do the lead work, but now you don't have to do the leg work because you can call Placing
Placing
Russell.
Russell. That's right. That's right. We
That's
do all of that for
awesome.
everybody.
So if anyone had
Yeah.
any questions
Sure.
or, inquiries or wanted to contact you for more information about your services, which are phenomenal, what is the
Thank you.
best way for them to reach you?
Sure. Well, there's a few ways to reach us. Of course, you can go to our website, which is www.placingrussell.com. So that's PLACINGRUSSELL. So www.placingrussell.com. They can call our office at 817 560 4344. They can also call my cell phone at 817 372 7351 and ask for Carol Hayes. I'll be the one picking it up, but still. And then they can also email me at chayes at placingrussell.com. So that would be CHAYES at placingrussell.com.
And that's Russell with two L's.
That's right. Thank you. It's Russell with two L's,
Yes.
two R's, and two L's.
Yes. Well, this has been such a great talk. Thank you so much, Carol, for
Thank you.
attending and educating the public on your services. Would love to have you back as your nonprofit grows and you guys get more established. And we'd love to
Sure.
have you back and hear more about that.
Absolutely. And thank you for having me.
Oh, you're
I
welcome.
wish you so much success. I thank you for what you're doing. I thank you for educating not only the healthcare advocates, but the public, the people. We need this information out there. I thank you.
Absolutely. Absolutely. It's my pleasure.
I appreciate
And
you.
thank you for attending. Well, thank you everyone for tuning in to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator, and I love bringing you reputable resources from your local communities. Tune in next time where we have another amazing chat. Bye bye.